I'm Dr Anthony Maloof from Eyes and Faces and Corneal Oculoplastic Surgery in Sydney, and welcome to this video edition on what is recurrent corneal erosion syndrome, otherwise known as recurrent erosion syndrome. Well, this is a condition where people wake up either during the middle of the night or in the morning with pain. Imagine you're asleep and you go to open your eyes and there's a tearing sensation, something's tearing at your eye, and you start screaming in pain because it's very painful. How painful? Imagine scratching your eye. It's not pleasant. Well, some people experience that very regularly. Sometimes it's predictable and sometimes it's unpredictable. It might be once a year, it might be once a week. Obviously the inconvenience is huge. So what's going on? Well, when you go to sleep at night, your eyelid covers your eye, and unfortunately your eye sticks to your eyelid, so when you open it up, it tears the front skin off the eye. Imagine this. Imagine I say to you, take your hand and rub it on your pants or dress. Do it every 10 seconds. Rub, rub, rub. After a while your hand will go red and then your skin will come off. That's because your hand hasn't evolved to rub on your thigh. Well, you blink and your eyelid comes down and has evolved to rub over your eye, and the skin has evolved to resist that. But under certain conditions, that fails. So typically this happens when you have an injury to your eye. So imagine the most common occurrence is a young child pokes their finger in your eye. It's very common. Second type of injury that's not uncommon is a hairbrush. You go to brush your eye, you have hair and you brush your eyes, and that scratches the eye. A leaf injuries, people in the garden get hit by a leaf. There are things called dystrophies where you can have a predisposition to this. So Reese-Buckler's dystrophy is one, epithelial basement membrane dystrophy is another, lattice dystrophy can do it. These are things that can happen due to an inborn difference in your genetic makeup. Finally, menopausal women can get this condition and they'll just start waking up with eye pain. So that's recurrent corneal erosion syndrome. Often it's treated with ointment, and sometimes it's treated surgically, and you might want to click here and you'll see one of our videos and presentations on how I treat this condition. So I hope that all makes sense. I'm Dr Anthony Maloof for Eyes and Faces and Corneal Oculoplastic Surgery in Sydney, and thanks for watching.